Hello and welcome back. My name is James. I'm the CEO of the deaf health charity SignHealth. Really nice to see you all. And I'm being supported today by a wonderful interpreter, Catherine. Thank you, Catherine, for your support. Um, yes, welcome back. This is my second blog post in the new series where I share news about our progress at SignHealth with equity, diversity and inclusion, or EDI. We also get to sit in the mud together and just feel what it's like to go on this journey and experience the discomfort of this work. So we are piloting a new anti-racism training course here at SignHealth at the moment. We've worked with Letitia Gibson at New Ways. I mentioned her last time. She has helped us make a new deaf version of their excellent and really successful anti-racism training. In fact, lots of people have worked really, really hard to make this happen, particularly the director, Bim Ajadi, and many others at the deaf set. So thank you to all of them. We are about halfway through the first wave of the pilot. So we're seeing what works, what doesn't work, and then we'll tweak the training before it gets rolled out to all staff at SignHealth. It's really, really exciting to see the conversations that we're having. We do our own learning by watching videos, thinking about some questions, or reading short articles, and then we come together in groups for facilitated conversations. Recently, we've been talking about social class, about racism, about British Sign Language. In our most recent session, we had all watched Rinku Barpaga's fantastic 2014 documentary, Double Discrimination. And we were reflecting on what's changed and what hasn't changed since 2014, since when the film was made. We talked about the quality and the level of BSL and that we are taught to aspire to, and the difficulties in preserving and protecting the language, whilst at the same time supporting its growth and acceptance from different communities who use it and have ownership of it. Really, really interesting. It often feels like there's so much to talk about, and it's really, really difficult to know which direction to go in. I also find it quite hard to maintain boundaries. We are really, really fascinated by the impact of racism on the deaf community, but I want to try and steer our work to make sure that it supports SignHealth's purpose. We are here to eliminate the health inequality that we experience as deaf people. We know that racism has a very, very, very big impact on people's health for lots of reasons. If we want to eliminate the health inequality for deaf people, that means tackling racism as well, because it all leads back to health. All of the ways in which our health is worsened, that's not just racism, that might be transphobia, it might be misogyny, it might be homophobia, all of those ways. We know that just because our identities and the system are not made together, they're not made with us in mind. A couple of years ago, we worked with Letitia to develop a written statement or ambition on anti-racism, and I loved it. I was really, really proud of it. It felt really clear to me and a very powerful like expression of what we wanted to achieve. I took it to our board and successfully got the board to approve it, to sign it off. But it took me too long to get it translated into sign language, to introduce it to staff, and then to launch it externally. And somehow we missed the moment. There was a lot of other stuff happening at the same time, and it kept kind of falling off people's priority lists. We are growing as an organization, and it isn't easy to make decisions about what is a priority. And I notice other leaders talking about their struggle to make EDI a priority. And this is my experience too. Despite me being very personally, like, really seriously personally committed to it, maybe we're all too busy, and we need to stop doing some stuff and really decide what's important. My colleagues are helping me learn that when something is a priority to me, I need to do a better job of explaining, of helping other people see that priority and to understand why. Just because it's obvious to me doesn't mean it's obvious to other people. That still catches me out. And also, I think I expected everyone to know what to do with this work. Lots of us actually haven't had the same access to the same learning that other people have. So there's a risk in assuming that we all know the same things. We know that there's a real lack of resources in our deaf community to learn about things like anti-racism in British Sign Language, for example. But whether you're deaf or hearing, none of us approach this work in exactly the same way because it's new to a lot of us. So we don't all have the same expectations or even any expectations. So planning or like predicting what will happen can be really hard. So at SignHealth, we are having another go. Um, this time we are aiming to develop a broader EDI strategy. That needs to link to our new 3-year plan at SignHealth and our new set of values, and to explain clearly why EDI is important to us, because it's part of health inequality. But it is making my head hurt a little bit. We are getting lots of help from loads of people. We're asking our trustees to help with it, not just to approve it. We are also asking members of SignHealth committees to help and to comment. And some of those people are not trustees, some of them independent members of committees. So that means they have lots of experience on things like EDI. So we're lucky to have existing connections with a really good range of people to help us. Really need to understand this work from an intersectional perspective and then be ready to explain it to other people who are less familiar with deaf culture and the impact of autism too. It's quite tiring, but it's really important work. And I'm confident we will get there this year. And then we'll be ready to talk more clearly about our ambitions and our plans for EDI at SignHealth in the months ahead. Finally, I'm really keen to keep championing other people's work, and I'd like to say a big thank you to Azaria Francis, who has been working at SignHealth as our EDI lead for about a year now. Azaria has really helped us make our dreams a reality by helping us get our anti-racism training off the ground and started. But she is also a member of the steering group for the Interpreters of Colour network. So if you need to book a BSL interpreter, I really recommend contacting IOCN. I've seen lots of discussion about EDI in recruitment and how important it is to try to have diverse panels for interviews. But I very, very rarely see this conversation extended to include interpreters or other professionals who support us as disabled people. I really, really believe that all of the people in the room, they matter, particularly if they look like us or if they share our backgrounds and our lived experience. There is real power there. So, as before, if you have any feedback or comments or suggestions, I'd be really, really happy to receive anything you want to say. Really keen to share our experiences and to make progress together. Thanks. And thanks, Catherine.